In this video, we will step into the dynamic realm of dental science, where revolutionary breakthroughs are reshaping patient care and redefining oral health standards. From regenerative techniques harnessing the body's natural healing powers to precision technologies, each advancement is tailored to enhance treatment accuracy and patient comfort. Dental care has evolved from the rudimentary tools of our ancestors to today's high-tech solutions that not only combat but also prevent oral diseases. This transformation is pivotal as dental health plays a crucial role in influencing overall health, including cardiovascular diseases and diabetes. The shift from manual scrapers to ultrasonic toothbrushes isn't just about innovation. It symbolizes a broader change in our understanding of healthcare, from treatment to prevention. This shift is crucial in our ongoing fight against chronic oral diseases that affect millions worldwide. The evolution of toothbrush technology exemplifies significant advancements in dental care. Ultrasonic toothbrushes using sonic vibrations to remove plaque represent a leap from traditional brushing techniques. Similarly, ionic toothbrushes alter the mouth's ionic environment to break down plaque effectively. Water flossers offer a modern take on flossing, using a stream of water to clean between teeth and below the gum line. Studies show that water flossers are not only more effective but also add a layer of convenience to daily oral care routines, encouraging consistent use. Probiotics are typically associated with gut health, but their benefits extend to oral health by balancing the oral microbiome, thus preventing harmful bacterial overgrowths that lead to disease. This approach signifies a shift towards preventive care through biological means. Advancements in tissue engineering have also made it possible to regenerate gum tissue, offering hope for those suffering from severe gum diseases. This technology uses bioengineered tissues that promote healing and regeneration, reducing the need for more invasive treatments. Iontophoresis involves the use of electrical currents to enhance the uptake of minerals like fluoride into the teeth, strengthening enamel and preventing decay. Electroforesis follows a similar principle but is primarily used to remove debris and stains from the teeth. These technologies represent a significant step forward in non-invasive dental treatments, providing options that are not only effective but also more comfortable for the patient, illustrating the shift towards patient-friendly technologies in dentistry. Genetic predispositions play a significant role in an individual's dental health. Identifying genes associated with diseases like tooth decay and gum disease can lead to targeted preventive measures and treatments. Emerging genetic therapies, including gene editing tools like CRISPR, offer potential cures by directly modifying the genetic factors contributing to these conditions. This approach could revolutionize dental care by preventing diseases before they manifest, shifting the focus from treatment to prevention. Nanohydroxyapatite is a breakthrough in enamel repair technology, mimicking the natural mineralization process to fill in microscopic cracks and rebuild enamel. This not only prevents sensitivity but also protects against cavities and decay. Nanoparticles are increasingly used in toothpaste and mouthwashes to provide a deep clean on a molecular level. Their small size allows them to penetrate biofilms and remove bacteria more effectively than traditional methods, highlighting the role of nanotechnology in enhancing everyday dental care products. Smart dental implants equipped with sensors provide real-time data on various health metrics, such as the presence of pathogens, pH levels, and overall oral health status. This information can be crucial for early detection and preventive treatment strategies. Further on the horizon are growth factors and stem cell therapies aimed at regenerating tooth structures, potentially making dental implants and dentures obsolete. These innovations are poised to redefine what's possible in dental restoration and regeneration. As with any advanced technology, the integration of genetics in dental care raises significant ethical questions. Who has access to these technologies? How do we handle the genetic data? These questions must be addressed to ensure these technologies benefit all segments of the population equally. Moreover, the socioeconomic factors influencing access to advanced dental care need to be considered to avoid widening health disparities. This highlights the need for policies that ensure fair access to the latest dental technologies. The oral microbiome plays a crucial role in our overall health, influencing everything from digestion to heart health. Recent studies have shown its direct impact on dental health, where an imbalance can lead to diseases such as gingivitis and periodontitis. Engineering the oral microbiome involves introducing beneficial bacteria that can counteract the harmful bacteria naturally present in the mouth. This approach not only helps in maintaining oral hygiene but also prevents the onset of disease, marking a significant advance in preventive dental care. This form of biotechnology not only aligns with our growing understanding of the microbiome's impact, but also highlights the shift towards more natural and sustainable approaches in medical treatments, including dentistry. CRISPR-Cas technology, a sophisticated form of gene editing, is being explored for its potential to revolutionize dental health by directly modifying genes that contribute to common dental conditions. This technology offers a way to potentially eliminate dental diseases at their genetic root. The applications extend to modifying salivary enzymes that affect the oral pH and bacterial environment, potentially preventing decay before it even starts. This proactive approach to dental health could significantly reduce the need for conventional treatments like fillings and root canals. This image of a CRISPR/Cas9 molecule at work highlights the precision of gene editing, enabling targeted interventions that were once deemed impossible, offering a new horizon in dental care technologies. The latest developments in dental imaging technology, such as AI-enhanced X-rays and real-time 3D imaging, are transforming diagnostic processes. These technologies not only provide clearer, more detailed images, but also allow for early detection of issues that might not be visible with traditional imaging techniques. Predictive analytics takes this a step further by using historical data and machine learning to assess the risk of dental diseases. This not only helps in early intervention, but also customizes treatment plans based on individual risk profiles, making dental care more personalized and effective. Photodynamic therapy for oral infections. Photodynamic therapy, or PDT, uses light-activated compounds to eradicate harmful organisms in the mouth without harming surrounding tissues. This approach has shown promising results, particularly in treating periodontal disease and dental infections by targeting and destroying pathogens. PDT offers a compelling alternative to traditional methods such as antibiotics, which can lead to resistance. The specificity and reduced side effects of PDT represent significant advancements in treating oral infections, aligning with the broader trend towards more targeted and less invasive treatments. Enzyme therapy for plaque control. Enzymes are nature's biocleaners, capable of breaking down complex molecules, including those that form dental plaque. Utilizing enzyme therapy in oral care products helps degrade plaque biofilms more effectively than mechanical cleaning alone, offering a new layer of prevention against tooth decay and gum disease. Studies into enzyme stability and activity within the oral environment are promising, suggesting that enzyme therapy could become a staple in oral hygiene routines. This not only enhances cleanliness but also reduces the chemical load in daily dental care products, reflecting a move towards more biologically oriented solutions in dentistry. Smart dental devices. The integration of the Internet of Things, or IoT, in dental devices is a game changer, offering personalized dental care through real-time feedback on brushing and flossing techniques. These smart devices can analyze habits and suggest improvements, making them a critical tool in preventive dental care. From smart toothbrushes that monitor brushing pressure and coverage to apps that track oral hygiene habits, these innovations are making dental care more interactive and precise. This not only enhances individual oral health, but also empowers users by integrating their dental care into the broader context of health and wellness monitoring. In conclusion, the future of dental health is being shaped by a convergence of technologies that promise not only to improve oral health care, but also to transform it into a more precise, personalized, and less invasive practice. As these technologies continue to evolve, they offer the promise of a world where dental disease is no longer a common concern, and the maintenance of oral health is seamlessly integrated into our daily lives.